Welcome to the office.
Hi.
Hi.
Welcome to the office.
Thank you.
So, you're coming from Rhode Island. What are you doing all the way from Rhode Island?
For help.
What's going on?
My hips seem to be too high. I just feel like all of my alignment. Pain in my knees, my hips, my back.
What's number one?
Hips.
Local pain, shooting pain, pain with movement. What's going on? Tell me.
I'm lucky. Like, I love to walk. I can't walk. I can't go to the gym because after so much moving, I end up getting pain in the hips that it radiate to the knees. So,
And then it gets to a point you can't walk
Yes.
because of the pain.
yes.
It's a stabbing pain.
Yeah, it's like achy, stabby.
Okay.
I walk, but I walked 2 days in a row, and after just walking 2 days, I couldn't walk for 2 days.
Okay. And when you say you couldn't walk for those next 2 days, what did that mean?
I was just in so much pain.
Got it. And it was all in the hips, not in the feet.
No, feet too.
Feet
Yeah,
too.
Yeah.
Okay, let's get back to the hip. When did all this start, man? What happened?
Mm.
What started this whole process for you?
I used to go every year for a chiropractor and physical therapy.
For what?
I had scoliosis, my hips were right up,
Okay.
and that worked out for a while. And then I got a new job. Medical was not good.
Okay.
And I kind of just back then, they kept on sending me to physical therapy to get fixed. And
For your back.
for my back.
Okay,
Yeah.
so this has been ongoing for many, many years.
Many, many years.
Many, many years. Okay.
Yes.
And so on that next job, your insurance you said wasn't so you went more physical therapy. That was the
Yeah,
protocol.
that's the protocol. They would send me that one. Yes.
Okay. And what else is going on besides that?
Just my whole. I just like when I'm walking. If I go up the stairs, I can't lift this leg up.
Okay.
Only if I'm holding on to something.
Okay.
And then I can. But other than that, it's like I'm on top of walking up like.
Up the stairs.
Yeah, and it's not that it hurts. It's more of pressure.
Okay.
Like yeah, it's not even like it hurts too much. I just can feel pressure.
On the right.
On the right, yes. I do have it on this side, but this one side feels worse than this side.
Okay, what else?
My knees. I ended up with a tear, and that ended up putting me out for like a year.
Oh wow.
Yeah. And then from that, not even a year later, from having this surgery, caused a tear in my ankle part going to the foot.
Okay.
Which they weren't able to do surgery on, so it kind of just.
Healed up with a bunch of scar tissue and adhesions.
Yes.
Okay. What else?
Just seeing the shoulder and neck. I just think everything's like out of alignment because I'm out of alignment. I can just feel everything in like a brick in my shoulders. It feels like all the time, like in the middle of the back here.
Mm-hmm. Okay.
Yeah.
Digestion.
Oh yeah. Last year, all of a sudden, I had issues with my lower GI, my upper GI, my gallbladder, and my pancreas.
So they removed the gallbladder,
They
yes?
removed the gallbladder. I was diagnosed with colitis.
Okay.
And we're still kind of trying to figure out the pancreas a year later.
I got some ideas.
Dear.
I got a few ideas. So let's talk about how you eat then and what the body does, because if there's an issue in the GI, we know there's no gallbladder there, so you're not storing the bile. So the first question I would ask with that is, were you told how to eat?
Not really.
Okay, because the frequency, the number of meals changes, the type changes, how you eat, everything changes when there's no gallbladder to store bile, to release the bile. But that also works in conjunction with the pancreas. Mm-hmm. And all of that is secondary to what we call hypochlorhydria, low stomach acid. And did you ever get a chance to watch those videos of the Florida couple that came?
I don't think so.
Okay,
I didn't watch a lot.
I'm going to send you the video. And Ruth, hope you're watching, and I'm sure you're doing amazing right now, and you and your husband. And this couple came from Florida. It took them three trips. And total, I think it was about 11 visits or something like that, not bad. And they wanted to remove a gallbladder, she had digestion, she had all this stuff going on. I'm going to encourage you to watch that video, okay? So, there's no gallbladder, so we know there were some gallstones and backup. We know that. That is all secondary to not having the appropriate stomach acid, and I talk in detail in these videos. If we don't have the appropriate stomach acid, when the food leaves the stomach and enters the first part of the small intestines, which is the duodenum, or the duodenum, that's if we don't have the acid there, then we don't have the proper acidity of the food, or the bolus they call it. So when it hits that the duodenum, we don't get stimulation of two hormones. One is CCK, cholecystokinin, goes to the gallbladder, release the bile. The other one is pancreatine or pancrealose, goes to the pancreas to release bicarbonate. If we don't have the release of that bicarbonate, we don't neutralize that food. So now we get itis, inflammation. So itis is just, itis means inflammation, colo is colon, so it's an inflamed colon. Okay, why? Are you following my process?
Yes.
So a lot of that is going to go all back to low stomach acid and working on the stomach. That's what we need to look at. Okay. What else? Good start?
Good start.
We got a week here. I'll probably see you twice a day.
Okay.
Starting on I guess we're starting in the afternoon today, but starting on Wednesday.
Okay.
2 on Wednesday, probably 2 on Friday. Okay?
Sounds good.
And I'm not in Tuesday, Thursday, but we'll see what we need to do.
Okay.
Okay. You ready to get started?
Ready.
This is looking at you from behind. This is the back profile. This is our side profile. And we're looking at many different things along the way. And you've watched videos, you kind of know how we're going to go through the process.
Yes.
First is the posture. And if we look at the posture, we just take the lowest lumbar right there. We run it straight up this line. And it should bisect through 2 and 7. And 7 is at the base here, so it's slightly behind. It's not too bad, okay? At least your neck up here goes through it good. So we have a little bit of this part being behind the foundation. We'll come back to this x-ray. Let's go over here and let's take a look and see. So yes, we have some curvature. You may have been told some mild scoliosis.
Yes.
You got some adjustments, some treatments, physical therapy, and that's all fine. Now, let's go ahead and look closer now and see what are some of the things that we see. We can see a short leg on the left side, number 1, and that short leg on the left is causing this curvature. The body compensates in the middle of the back. And does what? It wants to come back to neutral, but it doesn't stop, it continues. So that's that S-shape, classic S-shape mild scoliosis. And then we have a lot of calcification in the middle of the back here because of instability. A lot of these little hooks here, okay? And that's the body trying to stabilize instability. So if we can get the foundation stable, get you moving, I think we're going to be okay. And the digestion, of course.
Yes.
Okay. I'm probably going to start you on cleanse today, to be very honest with you.
Okay.
You're not here to try to go, you're not going to be able to go and eat all the yummy food here in LA, okay?
Yeah, no, I had some today and I wasn't.
Let's get you fixed up so then later in the future you guys can actually come back for and enjoy like a vacation, you know? Definitely. That would be kind of cool. So let's go back to the foundation now and let's look at the numbers and let's see what we see. And here's some of our answers. So yes, we have a tilted pelvis. It's dropped 10 millimeters on the left side. That's the current measured difference. We have a rotated pelvis. So whether we talk about the right side or the left side. I'll talk about the right side since the sacrum is rotated on that same side. And all of that goes opposite on the left. So let's look at this and what do we see? So short leg 10 millimeters on the left, rotated sacrum on the right, but the sacrum is dropped 3 on the left, so that's an old tailbone injury. And then we have the misalignment of the pelvis. So let's put it together. The right pelvis goes up and turns in. The sacrum on the right comes back. And the overall effect is that your body wants to go to the right side. but the short leg wants to bring you back. So I know when you walk, you got a little bit of that swing side to side, okay? The Rhode Island Shuffle or something, you're probably going to see. Here's some good news. If we can get this pelvis corrected, so if this one is up, this one is down. Whichever one we got to adjust, if we can fix it, we're going to get it up 3. That needs to be under 7 regardless. So between pelvis and sacrum, hopefully we can get it up in this trip. If not, regardless, I know you're coming back for follow-up, okay? So that's what I see in your foundation. That's the #1 issue, is the foundation, sacrum and pelvis. We will determine on the exam which one we're going to do first. Okay? Now, is that clear there?
Yes.
Okay. Now, what happens as a result? Look, you can see, we already know this stuff is there. We talked about there. Goes here. But I do want to talk about something here, because let me show you where gallbladder and stuff comes from. Gallbladder can be coming from up top around 5 with the liver, but can also be coming down here from 12, right where this kink is.
Does that cause aching pain?
That's the nerve. Those are nerves that control it.
Okay.
So I'm talking about the functioning of it.
Okay.
Okay. But the digestion is really in this part. 1, 2, 3, 4, 5, 6. So this is, if we want to be like technical here, this is going to be heart, lung, 1 through 4, liver, gallbladder, or liver.
Okay.
This is stomach. This is pancreas.
Oh, okay.
Okay, so your digestion issues are all starting in this part of the spine here.
Okay.
From anything related to the spine. Okay. Now, let's look at digestion. This is the Megan-Blasi. This is the gastric air bubble. I talk a lot about this. It should be a big black half circle this big. And then we have a lot of congestion, ascending, transverse, descending colon. We're not absorbing and assimilating. And we'll talk about someone who doesn't have a gallbladder. How should they be eating? They should be eating more meals, 5 meals, eating more frequently, smaller meals. The bile is to break down fat. So if you're eating a lot of fats in any meal, it's going to take a while for that thing to, and I'm sure you know that, right?
Yes.
So in your scenario, it may be ideal short term to supplement, and I do supplement when people don't have their gallbladder with some bile. And I do what's called cyclical dosing, so the body doesn't become dependent on it, okay, because your body makes the bile. But if we give too much bile, and too consistent, the body's going to see, hey, you got bile, I don't need to make anymore, and it shuts down the production in the liver.
Okay.
Okay. So far so good?
Yes.
All right. Now, let's take it. Okay, let's go now follow it up to the upper cervical. We have a little bit of a septum issue, if that's something we need to deal with. And now let's look at her neck. Upper cervical, in terms of the capsules, are fantastic. I like those. Let's go on the side. And let's get some answers now, man. Here we go. Look what we got here. We got L4 spondy. So the hip issue, we know pelvis foundation, but there's your answer. You have an L4 spondy. Spondylolisthesis, so you had an old traumatic fracture in the back. There was definitely a trauma, and that caused a slippage of your L4 moving forward onto 3 and 5. Okay. And what's interesting, this is like the 3rd, 4th one this past month. In the past month we're getting an L4. Usually spondies happen at 5. And the way the spondy happens is you get what's called a pars fracture in through there, and then it slips forward, and they don't typically go forward. Okay. So that adjustment is very different. You were never told this?
No.
You never had x-rays done? You never went to somebody who did x-rays or imaging?
Yeah, I did do x-rays, but I don't think they did the lower part. I think they just did the upper.
But you had hip pain.
I know.
Now as we go up, these discs are all good. These discs are good. These discs are good. These are a little bit thin. This is the digestion area. This whole area is a little bit thin. 2, 3, 4, 5. We have an old whiplash, C5, C6. But again, they're still good. Everything's, you're just, you need your alignment. You need to get everything back in balance now. Okay, and hopefully you're ready for it. Now, let's look at this versus this. This is neutral. This is flexion. In flexion, they should all kind of open up, right? And, well, no, it's not really a smooth going forward, is it? So, I need to reevaluate this here. What the heck's going on? You see there's a slippage between 2 and 3 going down, so she's got a lot of instability in her upper cervical mechanism. There's scar tissue over here, see 5, you have shallow breath. You have
sometimes,
shallow breath you get. Are there times where you, shortness.
Yeah.
Well, the good news overall is you have your discs, okay? You have stuff for us to work with. That's the great news. The next great news is your hips are still good, your sockets, okay? A little worn out, but they're still good. And the thing is, you just need movement. You don't have movement.
Okay.
So that's our goal starting today. And our goal while you're here is to see how many steps we can do. You hear me talk about 10,000 steps is our goal. Whatever you're going to do, but let's see what we can do.
Okay.
Okay. And along the way, you have questions you ask. And I'm trying to figure out how we're going to do the cleanse is 2 weeks, but you can at least start it now. Yeah, okay. Alright, let's get started. Alright, let's get started. Alright, walk it out, lady. So we're just watching your overall walk, okay?
Okay.
Just overall, whatever you're comfortable. Look straight ahead when you walk, please. There you go. Alright, come back over here and have a seat and let's get started. So yeah, we're not going to wait on the... Have a seat. Sit. Alright, let's get started. Starting at the base of the neck. And the first thing we're getting is way up top on the right. But we said C2 we know is unstable, so we may have to come back to that one. T5, T6, right side. Tiny one. Didn't stop. Didn't stop. It fooled us. It fooling us. It didn't stop. It's all coming from the tailbone. Well, I'm thinking something completely different in this case. Come back towards me, please. And I'll tell you why in a second, okay? Right there.
Oh.
Yes?
Yep.
That's 5. Tender.
Mm-hmm.
That's sacrum. I gotta go down low though. Right there.
Yep.
That's S3, S4. So I'm down here. Okay. There. If I come up to 5 is also an issue. Yes, ma'am?
Yep.
Okay. But we gotta start down in the basement. Okay?
Okay.
1, 2, 3, 4, 5. 6, 7, 6, 5.
Yep.
Okay, sorry.
Wow.
Burning, right?
Mm-hmm.
It's not a distinct break here, but it's going to show up. So this is my thought process before we get into all the other stuff. We're going to set the foundation, number 1, because that's throwing everything off.
Okay.
I'm going to set your foundation, I'm going to have you walk, and then I'm going to recheck everything and go from there.
Okay.
Okay? Because we need to decide, yeah, come on over here. We need to decide if we're gonna work on that upper cervical or not. And I'm a little hesitant because that C2 is, it looks like the ligament on C2. You pop and crack a lot.
Yes.
Yeah. We don't really want to mess with the neck right now if we don't have to.
Okay.
Go face down over here, Chris. You okay there?
Yep.
Sure?
Mm-hmm.
Sacrum. Slide up a little more. I'm holding. There you go. Alright, so we got two parts, man.
Okay.
We're going to do sacrum and we're going to work on the left pelvis. Gotcha. Now, I need to be on your glute here, ma'am, okay?
Okay.
I'm holding the right side down, out, and down. There you go. Bringing the left side up. Awesome. Wait for it. That was easy.
Thanks.
Hold my hand, please. Step off. Check it out. Let's walk.
Good. Wow.
A little different, right?
Yes.
One more time. Come back over here and have a seat. Now let's continue. Let's run the meter. A little different. Yep, we'll do 6. That's clear, man. That's clear. That's getting less now. Keep walking.
Keep walking.
Keep walking, then, please. And we're gonna do T6. 1, 2, 3, 4, 5, 6. Well, a couple of times as you walk. The more you walk, the easier it's gonna get. Keep walking. That C2 started to get less each time I was going, so I don't want to mess with that. Let's go back down on the gray table. Let's work on the mid-back, T6. Alright. This may be a little spicy, ma'am.
Okay.
You know. You guys get spice in Rhode Island or what?
Mm-hmm.
I went Baltimore.
You Baltimore? American.
I went once. But 9 years ago for some wellness conference. It's nice, actually. You good then?
Mm-hmm.
Oh! 4, 3, 2. And that's the hand run, lady. Good job. Now check it out.
These are
Tell us what's different as you're walking.
I can feel the difference. I don't sway as much.
Or fluid.
Yeah.
Have a seat. Let's continue. There you go. Yeah. I didn't touch the neck, it was going right the whole time. Now it's a little swing on, it's not the neck. That's all clear. S4 left pelvis T6. Go on your back now. Please. Let's work on your ankles. Sound is the board, not your foot breaking. Raise your right leg. Raise your left leg. Down. There you go. Sit, turn. Yep, sit up. Times. And let's go ahead and set her ears. Shoulders. Drop it down. There you go. There you go. Pretty cool. Now, you're going to get a buffy polish. This is vibration therapy. While you're here, today you'll start on the cleanse, you'll start on your walks, your icing, getting your movements in, keeping it real simple. You're staying close by?
Yes, sir.
Yes.
Cool. And we'll decide at the end of Wednesday what we need to do from there.
Okay. Thank you.
I just need to see how you're just going to respond to a couple of adjustments. And I'll make more. I'll make more decisions with you then at that point, okay?
Okay.
Alright, stand up for me, please. Squeeze the hand. Come over here. Squeeze the hand. Relax. Squeeze. Relax. Elbow. Look at me. Slowly open the mouth. Yeah, we need to work on that jaw. Have a seat. Jaw time. All the way back. Slowly open. Right goes out. Left compensates. Open all the way. Close half and hold. Nope. Open. Open. Close slow. Hold. Right there. Slowly close. Right there. There you go. Open. Open all the way. Slowly close. Slowly open. Yeah. Close. That's changing already. Open. I'm messing with it now. Today. Stand up, please. Stand over here. So part of your homework, hands on top of mine. Raise one leg. Stand on one leg. Just nice, just like that. It's okay. You're going to be able to hold on to something. Okay. So let's do it on the countertop now. Just hold on. And just practice. Okay. 2 minutes each leg. Deal?
Yeah.
Cool. Questions? Go back over here and see.
No?
Okay, so your case is number 1, foundation. Number 2 is digestion. Everything else is bonus for this trip.
Okay.
Okay, we need a place to start. Now, with the cleanse, you're going to go to the bathroom a lot. It's going to pee a lot. That's how the inflammation is going to come out. Okay? And it's very straightforward. They'll go over everything with you. It's 2 meal replacements. You get 1 meal a day, 2 snacks. There's also a yes list. If you're still hungry, no problem. Just eat off the yes list. Yeah, so you don't get hungry.
Okay.
Deal?
Yeah.
All right. Sir, you have any questions? Ma'am, you have any questions?
No, thank you.
Thank you.
Welcome to the office.
Thank you so much.
You're so welcome. Sir, pleasure.
Thank you.
Thank you for your service.